Okay, common medications for dysthymia. Now, just experiencing dysthymia, experiencing kind of a feeling of unwellness, feeling depressed, is not enough to diagnose and treat someone with depression medications. There's certain criteria that needs to be evaluated by your psychiatrist. If you meet that criteria, depression medications might be an option, but it's not something you just say, I feel bad, I need meds. Typically, a psychiatrist will start with a class of medications called SSRIs, or selective serotonin reuptake inhibitors, if a patient meets criteria for major depressive disorder and there are not other possible things that could be causing it that haven't been ruled out already. This would be medications like fluoxetine or sertraline or other medications like this. You can just Google SSRIs and it'll show you a list online. Interesting to note though, that there's been some research done comparing the effectiveness of these depression medications against exercise. And they found that exercise, some of the studies demonstrated that exercise was as effective, if not more effective, than the best depression medications that I could offer as a psychiatrist. So what I'll often do is if someone comes in and they don't feel good, I'll recommend that they exercise. And it was 30 minutes of cardiovascular exercise 3 to 5 times a week with a heart rate above 120. Now, is that always going to cure all of it? No, it's not always going to cure all of it. But if I can offer something to someone that's also going to give them cardiovascular benefits, it's going to give them other kinds of benefits in their life, I'd prefer to go with that. And plus, it has no negative side effects and has lots of positive side effects. Exercise is fantastic. Another thing that I do is cognitive behavioral therapy. They've tested SSRIs against cognitive behavioral therapy, and they found that a similar thing is true. Sometimes cognitive behavioral therapy can perform as well or better than SSRI medications for depression and anxiety. Now, there are other conditions like a bipolar disorder or schizophrenia, and exercise and cognitive behavioral therapy they're not gonna touch that. You're gonna need meds. You need to see a psychiatrist and talk about medication. Sometimes, if you've done these other things, sometimes an SSRI is the only thing that can do it. And I've had experience with that, and nothing else worked. Finally, I got an SSRI in place, and it worked. And sometimes using one SSRI doesn't work, and I have to add another one on there. Combination of something like sertraline and Wellbutrin or mirtazapine. You need to talk to your psychiatrist about all these things before you do any of this stuff. There are negative side effects to a lot of these medications, and that needs to be discussed. There's also other conditions that can be causing the mood, such as hypothyroidism. There's other conditions that can be complex and needs to be evaluated by a psychiatrist.